Hi everyone, my name is Kwekwe. I'm a pharmacist. Today I'll be reviewing the medication azithromycin, one of the most commonly prescribed antibiotics that you've probably heard of and know as ZPAC. So in the next few minutes, I'll cover what azithromycin is, how it works, proper dosing, side effects, and important safety tips that I believe you should know if you've been prescribed this medication or if you're considering it. Now, quick disclaimer that this video is for educational purposes only. Please do not stop, or make any changes to your medication regimen without first consulting your doctor. So let's start with the basics. What exactly is azithromycin? Well, azithromycin, sold under the brand name Zithromax, or more commonly Z-Pak, belongs to a class of antibiotics called macrolides. It is specifically a broad-spectrum antibiotic, which means that it can fight many different types of bacteria. Azithromycin is FDA approved for treating bacterial infections, including respiratory tract infections such as pneumonia and bronchitis, skin and soft tissue infections, ear infections, strep throat, and certain sexually transmitted infections like gonorrhea. Now, it is also used to treat some eye infections when administered as eye drops. What makes azithromycin special is its convenience. It's often prescribed as a 5-day course, with the famous Z-Pak being just 6 pills in total. It also stays in your body longer than many other antibiotics, allowing you to take it just once daily. Azithromycin has been around since 1991. Now let's talk about how azithromycin fights bacterial infections in your body. Azithromycin works by targeting the bacteria's ability to make certain proteins. Now, bacteria need to make specific proteins to grow, multiply, and survive. Azithromycin blocks this protein-making process. Obviously, when bacteria can't make the proteins they need, they cannot grow or multiply, and eventually, many of them die off. Now, here's something interesting. Azithromycin doesn't just fight bacteria, it also has anti-inflammatory effects that can help reduce inflammation associated with infections, which may help you feel better faster. Also, because it stays in your tissues for days after the last dose, azithromycin continues working even after you finish taking it, which is why shorter courses can still be effective. Now let's talk about how to take azithromycin properly. Azithromycin comes in tablet, capsules, and a liquid suspension. The most common dosing is the Z-Pak, which contains 6 250 milligram tablets taken over 5 days. 2 tablets on day 1, then 1 tablet daily for days 2 through 5. Now, while this is the most common way to take azithromycin, there are other instances when the dosage may be modified. For example, for treating gonorrhea, it is not unusual to see a one-time dose of 1 gram of azithromycin. So obviously it goes without saying that you should really pay particular attention and follow your doctor's specific instructions for your individual case. Azithromycin can be taken with or without food. However, taking it with food may help reduce stomach upset if you experience any. Now here's a pro tip. Avoid taking azithromycin within 2 hours of aluminum or magnesium containing antacids, as these can interfere with absorption. Also, take your dose at roughly the same time each day to maintain consistent levels in your body. If you are taking the liquid suspension, shake the bottle well before measuring each dose and use the measuring device that comes with it for accuracy. Store the liquid at room temperature and discard any unused portion after 10 days. Now let's cover some important safety information that can help you use azithromycin safely. First and foremost, don't take azithromycin obviously if you're allergic to it or any other macrolide antibiotics. So for example, erythromycin or clarithromycin. If there's a past allergy history, it's best to avoid azithromycin. Also, if you have heart rhythm problems or take certain medications that affect heart rhythm, make sure your doctor knows. Azithromycin can cause a condition called QT prolongation, which can lead to dangerous heart rhythms, especially in people who are already at risk. For pregnancy and breastfeeding, azithromycin is generally considered safe. However, always discuss with your doctor first if you have any concerns or questions. Also, azithromycin can make you more sensitive to sunlight, so wear sunscreen and protective clothing when outdoors during treatment. Now, the good thing is that unlike some antibiotics, azithromycin typically does not interfere with birth controls, but it's always good to use a backup contraception method when you're taking any antibiotic just to be on the safe side and to err on the side of caution. Now, here's something important. If you develop severe diarrhea, especially with blood or mucus, contact your doctor immediately. This could be a sign of a condition called Clostridium difficile or C. difficile infection. Now let's talk about some potential side effects that you might experience while taking azithromycin. The good thing is that most of them are mild and manageable. So the most common side effects are usually digestive in nature. So we have like nausea, diarrhea, abdominal pain, and vomiting. It's estimated that about 5% of people experience diarrhea and about 3% also experience nausea or abdominal pain. You might also experience headache, dizziness, or mild skin reactions. Some people also notice changes in their taste while taking the medication. Now, here are some tips to help minimize some of the side effects. First of all, take azithromycin with food if you get an upset stomach. Stay well hydrated and eat foods with probiotics like yogurt to help maintain a healthy gut bacteria while you're on the medication. For nausea, try taking the medication with a light meal or snack. Avoid spicy, fatty, or very sweet foods during treatment, which can also go a long way to help. Most of these side effects, like I already said, are temporary and will resolve once you finish the course of the antibiotic. However, if you experience persistent vomiting that prevents you from keeping the medication down, contact your doctor. They may need to switch you to a different antibiotic or give you some anti-nausea medication. Now let's discuss potentially serious side effects that require immediate attention. These are uncommon, but it's important to recognize, and these are the ones that you would want to inform your doctor about. The most serious concern is something called QT prolongation or torsade de pointes. This is more likely in older adults, people with existing heart condition, or those taking other medications that also affect heart rhythm. Now, signs may include fainting, very fast or irregular heartbeat, or feeling like your heart is skipping beats. C. difficile associated diarrhea is also another serious condition where harmful bacteria take over your gut. Warning signs include severe, persistent diarrhea, abdominal cramping, fever, or blood in your stool. These are all signs that you need to reach out to your doctor. Now, this can occur during treatment or even up to 2 months after finishing the antibiotic. There's also rare cases of liver problems, and signs may include yellowing of your skin or eyes, dark urine, severe abdominal pain, or unusual fatigue. If you experience any of these potentially serious side effects, stop taking the medication and talk to your doctor or seek emergency medical care immediately. Now, like I said, remember these side effects are rare as azithromycin has been used safely by millions of people for decades. So the key is knowing what to watch for and getting the help you need promptly. I sincerely hope you found some value in this video. If you did, please share with somebody who may also find it interesting. As always, stay blessed and I'll catch you on the next video. Thank you.